Welcome back to the Innovators of Health podcast with my co-host here, Dr. Rahul Desai. Um, Today we have two special guests here, Dr. Kelly Van Vickle and Dr. Kelly Thompson from Key Wellness. So thank you both for joining us today.
You're welcome. Thanks for having us. And we're actually both nurse practitioners
Okay.
here. Yeah. I'm Kelly Van Vickle.
I'm Kelly Thompson.
So from my research, you've had over 20 years in nursing and women's health. Is that correct? And so what
Yeah.
and so what all right, so what inspired you to move from the traditional nursing to build this practice?
I think we were just ready for a change to be able to offer our patients more solutions and comprehensive care outside of what we were able to do in our traditional practice.
Yes, and I think the pandemic played a role in that, in just finally giving us the fuel we needed to go, there's got to be a better way.
So we jumped.
And here we are 4 years later.
Yeah.
And expanding and growing, and it's a good problem to have.
Can you tell us how your practice morphed from the traditional and like what you're actually doing right now and how you're affecting change?
So we offer a little bit of everything here. We still practice traditional medicine, I'll still write regular prescriptions, but I think we look at it from a more holistic point of view, looking for, root cause versus just treating a symptom. And so we do everything from some minor urgent care sort of visits to wellness visits. We do a lot of weight management and hormone management, IV therapy, and then we have a full med spa as well. So we do full line of injections and facials and lasers and all the things with that.
Very cool. And have you the patients that you were seeing in your prior practices, did they come over to your new practice? Did you have to start afresh, or that's a big shift. How did you guys change that?
Yeah, we had a really big patient base to begin with, and many, many, many of them have found us. Some right away, some maybe tried a different healthcare provider and then found us a year or more later going, I need you. I need the way you took care of me. Because even in our previous practice, we really always looked at that whole person, and neither one of us were just like, here's your prescription out the door. We always looked at root cause, and we really wanted to be able to continue to do that and even take a deeper dive into that. And that's what landed us here.
I think when we started, and we still don't accept insurance, all of our patients are cash pay for their visits. That's a little newer philosophy. There aren't many other practices in the area that operate that way. So it took a little bit of education and explaining to patients how that looks, and actually what cost savings could be for them from a payment standpoint, cash versus paying your deductible if they had a high deductible. So I think a lot of our patients, once they understood that, then that caused them to come our way even more so.
Yeah. And then results, right? If they're getting great results, that's word of mouth, and that's going to spread.
We've certainly added to our patient base tremendously as well. We've met some really amazing people and have been able to help out many people. And, a lot of patients are looking for something more natural, something more holistic, and not, just a prescription and out the door.
Mm-hmm.
Right. Just not being ran through the mill in a 20-minute visit. So we hear it time and time again that, thank you for taking the time to listen to us. I finally feel heard. And I mean, really, that's what it is listening and doing a thorough interview with them and not trying to rush them out the door. With
And we'll make out a whole plan, it's like, first we're going to address this and see how you do. And then once we have that under control, then we'll look at the next concern and, just slowly, tackle all of their health needs. But maybe being honest, going, I'm not going to fix all of this today, but we'll get to it. It's just, what's your number one priority?
yeah.
And it sounds like you're also taking them along that journey of, addressing the concerns, feeling better, getting to the root cause, and then also all the way to thriving, and then, with the aesthetics and feeling better, looking better, being more vital. That's exciting. That's a nice continuum to be able to have.
So what's the
Yeah,
typical
I
journey?
think we both just really focus on quality of life and longevity. And while we're on this earth, we want to feel good. And when you look good, you feel a little better too. So, not, like if it's a student and they have really bad acne, it's like, well, what products are you using? What's your diet look like? What are your health practices? All of that, and fixing it.
And I think, just recognizing too that as a woman, especially, we take care of a lot of men as well, but especially for women, often we're putting ourselves on the back burner and not taking that time to address concerns. And so when they finally do come in, I do want them to feel heard and know that their time is valuable, and really interview them about all the things, even mental health and sexual health, and not just if they're there for a weight concern. It's all encompassing, and just really trying to make them feel like we value them coming in and we want to take care of them.
No, absolutely. How did you get involved with, I'm super passionate about photobiomodulation and red light, and you're kind of hitting a lot of points as far as longevity and wellness, and even transitioning to, pain and sexual health, and, depression, anxiety. It covers so many different things. How did you get involved in it? Or how did you get exposed to
I think that was
photobiomodulation?
you.
Well, I was a skeptic, if I'm honest. Really, what is light going to do? How does that work? And a family member, her oncologist, actually recommended it for her, and she was seeing results with it. So for her, she was dealing with some bone pain that she was experiencing as a side effect of one of her chemotherapy medications, and she used red light for, it was maybe a month or so, and had very minimal, if any, bone pain. I was like, okay, well, maybe there's something to it. And then she was on vacation and gone, wasn't able to use it for a couple of weeks. Bone pain returned. She got back into her regimen, and within a month, pain was better again. And so she's telling me, Kelly, there's something here. So we started talking about it and researching, and now we've experienced it for ourselves and believe in it so much. Each of our staff, we bought a unit for each of our staff to have at home, because we care about their health, and of course, not just wanting to keep them healthy so they can come to work, but just for their quality of life. And it's easy, it's simple to do,
and it's not a medication. And and I think when we can speak about, I can say, well, my mom is 77 and she uses it for this and it works great. And my 25-year-old stops at my house 5 days a week and uses it before bedtime because she sleeps better when, and some of my kids have had sports injuries, and, so when we can speak from a firsthand, basis, like if I wouldn't want my mom, my kids, myself to use it, why would I want you to? And,
and it's not, I'm kind of a guinea pig here. We try everything that we offer for treatments. We do it first for ourselves, and we want to know A, what to expect, what to tell our patients, but B, that it works. We value our clients' time, but we also value their money. And if we're going to get behind something and say, hey, I think you should try this, we want to know that there's going to be results with it. And from many different areas, we can say that we've experienced it ourselves. We've seen it firsthand.
Kelly T, you have 5 children, correct?
Correct.
Yeah, kudos. We have 5 too. So we're got the basketball starting 5. Yeah, it's interesting. My entire family uses it. It has its now own. We have the 300, the 3-foot
Right.
panel, and it has its own space in our living room, and it's on every single day, multiple times,
Mine
for
too.
different uses.
Mhm.
Yeah, that's incredible. And so that's I think a really neat transition where you believe it yourself, it's helping you heal, and then you're able to with confidence and passion talk about it to your clients and patients. Are there any cases, like, what are you using it for? Have you seen any oftentimes there are those like aha moments or those sentinel cases that are like, man, this is pretty awesome. Have you run across any of those types of events? Or
Yeah, I use it personally. I'm not historically, mornings are not my time of day. It's a snooze, snooze, snooze. And instead of hitting snooze, so I also have the 3-foot panel and it's right next to the bed. So I literally turn my alarm off and fumble around and find a on button and turn it on. And I do that for 5 to 10 minutes in the morning, and it wakes me up and I feel energized and more focused. And I know on days that I don't do it, I'm kicking myself later that I should have done that this morning. And then I do it before bed as well for better sleep. And we've seen improvements with respiratory stuff, sinus infections, improved pain, a lot of mental health improvements with use of it, as far as like seasonal affective disorder. I have a patient who's quadriplegic. It's not a full quadriplegic, or hemiplegic, sorry. And he had some mobility and was experiencing a decline in his mobility. And they have a unit now, a 3-foot unit, and that's part of his overall treatment regimen. And all their family members are using it, and they're noticing differences in their mental health and energy. His strength is improving.
He actually took a step, you said.
Yeah, yes, he was in yesterday, and he was able to walk up 2 steps yesterday, or in the past week. So
I'd be really interested to know. We had a conversation with a doc that's a hyper specialist for doing this with TMJ and using PRP and regenerative, like helping tremendously as an adjunct. And because I'm super passionate about it, it's changed my life. I'm watching it change others' lives, and we want to get this information out there. I think I get so exuberant about it, and I talk about all the different things that it can do, like, because it's amazing, right? It's just like from anxiety to toe pain. I mean, it's like treating all these things. And so I'm just really interested in your type of practice. How do you explain it to patients? Because I think sometimes it's challenging because you want to say so much and you only have so much time.
Right.
I'm just wondering how you address, like, when you talk about this, because I call it a medicine, even though it's not a medication. It's like, it is medicine. It's like nature's medicine that's helping us. But how do you how do you come to patients and try to, like, that initial conversation? I'm always interested in how to better explain it.
Well, often we have 5 units here in the clinic in each of our treatment rooms, exam rooms. So we turn it on for them a lot of times. Like if I'm going to go, draw up their tox treatment, or they're waiting for us, if we're running behind, our nurses will turn it on for our patients while they're waiting. And that often starts the conversation. Well, tell me about red light. Like, oh, I've heard about this. Tell me more about it.
And I would say 95% of our IV therapy patients because they're in our chair for 45 minutes to an hour. So 20 of the minutes, whatever they're here for, we turn the red light on, and then that sparks a conversation. My elevator speech, really, I kind of go to the cellular level, the mitochondria of the cell, without trying to complicate it. And, very simply, like, this is why it works, this is how it works, and patients usually, I'm like, you got to think back to science class.
Yeah,
Like,
eighth grade science of
mitochondria, the little powerhouse of the cells, and then people are like, oh, and, and then the wheels get spinning, and then, sometimes they ask more questions, sometimes they don't.
Yeah.
Yeah.
And I'll usually share with them that I was a skeptic too until I had, family members, oncologists recommended it. And when they hear that, okay, there's traditional providers that are maybe stepping on board with it too, I think it's a really progressive oncologist to recommend that for one of his patients, for one. But I think that kind of, perks their ears up. And then just sharing with them, it helps at the cellular level increase energy and the production of energy within your cells. So it can help with recovery, anything from an injury to improving your skin quality and anything in between. And then I should just share that, all of us here have one in our homes, and we use them, if not daily, most days of the week. So that's kind of how we present it to them.
Right.
So it's being presented as a lifelong, like, from what I'm hearing, this is something that they're going to start, and it's part of their now wellness regimen.
Right. Yeah, there's a local clinic, maybe within a half hour of us, that they do a lot of red light therapy, but it's sessions for patients. And I tell them, really, to see the benefit of it, this is something you should do at least 3 days, if not daily, at least 3 days a week. And so it makes sense to, if you're going to be paying money for sessions, having it in your home where you can experience the long-term benefits of it. And that's usually what I say. And I just have mine next to my bed and I pop it on in the morning.
And I think a question we get to, or I have gotten, we work together. We don't always talk, but people will be like, well, I found one on Amazon and it's, $50. I'm like, we're apples and oranges, and trying to explain wavelengths and near infrared and red. And I'm like, you're not getting the same, red light on Amazon. Sorry.
I'll usually jump in and say, talk about the dose of it. I can't speak to the quality of what you bought because I don't know the dose and the studies behind that particular machine. I know the research behind the company that we use, and, with 7 to 9 minutes of daily use, you're going to see those results. It needs to be within a certain, distance to you. So it really is, it's like, going out and buying an over-the-counter skincare or, supplement from a local box store versus paying for a higher grade supplement that's been vetted. And same with skincare. Well, I think we lost Dr. Desai for a second, but he's back. Okay.
Sure, I'm back.
So I think that's probably one of the biggest things that we will hear from patients is that, well, I've seen them on, wherever for significantly cheaper, but this is a case of you get what you pay for.
Yeah. So, and it works, right? You don't know about the other things, but you know that this works, and it has a result that you can count on. What can you speak to some other surprising sort of cases that you've seen with patients?
Yeah. 2 that stand out in my brain. I have a gentleman with pretty significant psoriasis and then psoriatic arthritis, and he's been using it, and psoriasis remarkably improved, and his psoriatic arthritis nearly gone with no medication changes. He's done very, very well. And then another patient I recently started, I haven't seen back, but Crohn's diagnosis and really wanting to not be on disease modifying agents as much as possible. And, I didn't stop anything. I'm like, you can safely add this. And then, if you have a reduction in symptoms, we can work with your, gastroenterologist and chat about, would it be possible to cut back on your dosage and see how you do? So I'm optimistic, but I haven't seen back yet.
Are they? I'm just curious because that's pretty amazing. Like, I'd love to talk to you more about it, even after the podcast, and kind of get some information about dosing, especially with the psoriatic, arthritis. It can pretty devastating disease, and both can be with Crohn's, and uh, just like how they're dosing it. Is it once or twice a day? And what we're seeing is like where you were speaking of is that daily dosing, kind of that microdosing, is so critical, and how that can really be cumulative. And then one other thing, I don't know if I started, diving into this a little bit more, but there is published data now, and it makes sense with sunrise and sunset. That's when we naturally get that red and near infrared light, is that our body actually absorbs the light and reacts differently at different times of the day based on the circadian rhythm. So in the morning, it can be much more energizing. And they did animal studies where there's more ATP produced in the AM out with the normal sleep cycle in the AM hours. And then in the evening, there's less ATP produced, but maybe higher levels of melatonin, growth hormone, and kind of the rest and repair and recover sort of pathophysiology that occurs. The same medicine, but there's an innate intelligence, just from evolutionary biology that works. It's totally fascinating. And then neurocognition and anxiety and depression and even addiction. There's studies that are coming out demonstrating the benefits. So it's really interesting that you mentioned that kind of pretty quickly, that you're seeing, changes in mood, which is fantastic, and not having any side effects, and being able to do this. So, man, kudos to you guys for incorporating it.
Another patient of mine, she bought a unit at home, and then her husband got interested in this. I saw her a couple of weeks ago, and she was sharing with me that he'd had a shoulder surgery. He'd had a previous shoulder surgery, and it was awful as far as his recovery and pain. And she had him use the red light. I don't know, how many times a day or how many days a week he was using it, but she now wants to buy another unit because he always has it. His pain, he healed so much better after the surgery than he did with his previous surgery. So he uses it after exercise, workout, physical therapy, and yeah, he's taken it over.
Do you see this playing maybe a more significant or different role in menopause? I know that there's so many physiologic changes that are occurring there, and with the the breadth and ability of this to treat that. Have you seen any cases like that, or have you thought of, like, is there any specifics and implementation around that, or perimenopause or menopause for women?
No doubt in my mind it will benefit from a mental health standpoint and sleep, because, we do a lot of hormone replacement, and getting good sleep and better energy is always an issue, always an issue. And a lot of times there's a lot of inflammation going on in their bodies as well. So getting inflammation down, better sleep, increased energy, absolutely. No doubt in my mind, it would benefit probably every single perimenopausal/menopausal woman on the planet.
Yeah, I can't say that. I haven't recommended it specifically for menopause, but as part of their comprehensive plan, just for the reasons that Cal mentioned. Yeah, it makes sense to be a part of that. We're both within that age range, so we can speak to the benefits of it. But on the flip side too, I have a 2-year-old or 2.5-year-old granddaughter that has eczema, and she always wants to jump in and Gammy, can I do the light? Can I do the light? And she'll, sit there for a few minutes with her hands under it. And so it's safe just for the whole family to use.
My kids are convinced one of my dogs is going to live forever because you flip that red light on, he is on you like he's 14 years old, but he doesn't act like it. My kids are like, it's the red light, Mom. He's going to live forever. I'm like, it's absolutely kind of funny. It's like, you can't red light without that dog. He probably gets more than his dose that he needs, but oh well.
I think there's just there's so much interest in alternative methods for care right now. I think that it's just going to keep expanding and exploding and then becoming more integrated.
What do you say to people, other nurse practitioners and folks who are on the fence and have not yet taken advantage of red light and photobiomodulation in their clinics the way you have? Any advice to them?
I would tell them, try it, like experience it yourself. And, for whatever health concern they have. And I would challenge them to try to say it didn't help them, because again, we were both very skeptical. We're like, but it does not take very long. And that's even the thing, like in a single IV therapy session, or someone's waiting for us aesthetically and they flip that light on for, 10 minutes. It does not take very long, and patients, they can feel something, the energy, the warmth, and it really peaks them.
There's so much research out there, even from an aesthetic standpoint, and we didn't really talk about that, but we've integrated it into our hair loss protocol that we do for hair loss treatment. We use it before and or after some of our aesthetic treatments, just to boost results and longevity of their results or improve their treatment. And this was several months ago. I had a sinus infection and had so much pain in my face. I came in one of the rooms and sat with it for 10 minutes and walked out and didn't feel like I had a throbbing heartbeat in my sinuses. So you don't have to use it for weeks upon weeks to feel a difference or notice the difference with it. That would be our advice to clinicians that are on the fence. Just try it and see for yourself, and then you can speak to it with your patients.
What do you say to patients who bring up the mask? Is that something that you commonly hear people bring it up?
The mask. Oh yeah. I get asked that a lot. And same thing as the whole Amazon thing. I'm like, I can't speak to that. And I will just say it doesn't need to be applied to your face to have benefit.
Well, it shouldn't have to if it's an adequate dose. And that's what I'll tell patients too, that there has to be enough energy of the right wavelength applied for the right amount of time in order for it to be effective. And I can't speak to, the studies or the research or lack thereof for these other devices, but I know the dose and the results with this particular machine.
I also think they can use it for other things, right? I mean, that's the beauty of it.
If you buy a mask, it's for your face. You can't use it on your knee. You can't use it on your shoulder.
Yeah.
Right.
Very good. Very cool. Well, it's super exciting that you guys have implemented it across so many different strategies. As far as you're practicing in Minnesota, is that correct?
Correct.
Or where at? What part of Minnesota?
North Central. So we're in Cross Lake. If you look at the state of Minnesota, the exact middle, just a tiny bit north of there.
Okay.
Brainerd Lakes area is a common or well-known vacation spot in Minnesota. So we're within that region.
I got another question for you.
Interested in, go ahead, Jay.
No, I'm curious about the staff, about how did you get your staff behind this? It sounds like you've got sort of everyone, enrolled and behind this as medicine. What, did it take long for your staff to get on board? Was it pretty easy?
I don't think it took very long. They were all, like tell us about it. And then,
Well, and so when we decided to buy devices for the staff, I told people, I'll pay for half. If you want one, let me know what size you want, and then we'll get them ordered. And thinking that if they feel that they're going to put some investment in it, then they'll be more likely to use it. And every single one of our staff said, yes, I want one. And so then them not knowing we were going to pay for them outright for them. But yeah, so I think, they've seen it, they've used it while they're here. They've heard our spiels enough with patients and have seen results with our patients too. So I think that, yeah, they're,
and I think that helps too, because, if a patient asks any one of our staff members, they can speak to, hey, I have that exact unit in my home, and
Mhm.
this is what we use it for, fill in the blank. So,
Now, the reason why I was asking is because we're talking about people being on the fence, and and in your advice to other practitioners, anybody that's listening to this, to get them to, think about why to have it in their practice. Sometimes the concern is getting their staff on board, and it sounds like that's another way to overcome it, is by making sure that your staff gets an opportunity to experience it, because then they will also be able to feel it and then believe in the medicine and the science themselves.
mhm.
yeah, just having the units available in the clinic to use. That's, I guess that would be a suggestion. Just get one in your space and encourage people to use it. Turn it on for your patients. If patients are paying for a service here, we don't, maybe it's the best financial decision, but we don't do an add-on charge for that, because
Right.
we want them to experience it. That's how much we believe in us. It's, and the amount of people that then, express interest in, well, how do I get one? Yeah, so it doesn't feel as salesy.
And it
Mhm.
kind of sells itself.
It does sell.
Yeah, we don't
Mhm.
really have to sell anything. It really sells itself. And, we have the little QR, people can scan that. The company's wonderful about reaching back out to patients if, we provide some contact information, and,
I've reached out, hey, I need information on, red light, and so we're going to integrate it as part of our body contouring that we offer here. And so Rusty, I think, talked to
Yeah.
Dr. Desai and got his information back on it. So it's just, there's a lot of support there within the company too. So it doesn't feel like we were sold something and then left to fend for ourselves. We can tell that there's passion behind the
No, that's
checkout.
great. Thank you very much. Anything that we haven't asked you that you were hoping that we would ask?
It's a good question. I don't think so.
it's just definitely added a really amazing element to my practice. And again, I'm always about the least amount of medicine that's going to help somebody. If I can do it through diet, exercise, a vitamin, a supplement instead of a prescription, I'm always going to do that.
Mhm.
And if one thing does it, why do two or three? And, I really try to avoid polypharmacy and, even when it comes to vitamins and supplements. So for me, it's definitely made a positive impact on my practice. So,
Just a nice adjunctive therapy to round out that comprehensive care that we strive to give.
yeah.
Very cool. Can I ask you
Wonderful.
one question also, Jay? I want to just like a
Yeah.
clinical question. So are you using peptides for weight loss and like functionality?
Yes.
Yeah, so we're using the typical peptides for weight loss, the well-known ones, and we're starting to integrate other peptides into our practice as well.
And do you see that as, because I see it as a fantastic opportunity for the clinicians and obviously the patients, of stacking that with the PBM. And I think hopefully you got that some of the articles on the body contouring. There was one fascinating one out of Brazil where they did the abdominal circumference and the ultrasound measurements and actually took biopsies of the tissue. I don't know if you guys saw that one, but it seemed to work really well for reduction in fat, the targeted therapy. So that's another, I think, a really cool way of applying it. Have you started doing that, or is that something on the radar?
Is integrating it with our body contouring.
Yeah.
Yeah. So our patients they'll do it as part of their body contouring sessions.
Okay. Very cool. Yeah, I'd love to, even offline, just talk to you more about it. I find it fascinating. And then we get a lot of questions from other practitioners as well. I'm speaking, I think, tomorrow or this week with a nurse practitioner out of Ohio, or Pittsburgh, and they're interested in kind of adding these modalities and energy-based therapies to their hormones and peptides as well. So it seems like it's a kind of a perfect timing for those things, and like skin
Yeah, it
tightening and
might be
rejuvenation.
fun for a bunch of us that utilize Red Vibe to like have a networking, even if it was just via Zoom, like, how are you utilizing this? How are we, because I think we can all learn from each other. I mean, I
That's
feel
a
like
great idea.
use it in many ways, but I'm sure there's things where we haven't recognized and do not have experience in yet. So it'd be super fun to network and find out what we may be missing or
That's a great idea. We will make that happen.
Yeah.
That's
I,
awesome. I love it.
I love it.
All right.
Wonderful. Well, thank you both so much for your time. Key Wellness again. Besides your website, you guys, Instagram, Facebook, I'm sure those are pretty common places to find you. Okay.
We're on.
Find us on all the platforms. Yep.
All right. We'll make sure that that's all going to be in the show notes.
Thank you. And again, thanks for inviting us on, and
Thank you.
speaking with you.
Yes.
Yeah,
Wonderful.
great having you on. Thank you. Keep up the great
Thank you.
work. Thanks.
Thanks.
Thanks.